And good afternoon, everyone. Thanks so much for joining us for this, our first COVID-19 press briefing of the week. We have much to discuss today. Today, Orange County Mayor Jerry O. Demings will discuss our goals for the week, the lowering of the age requirement for the vaccine, and the partnership with our collegiate community to further vaccination efforts. The mayor will also discuss our COVID infection numbers, our positivity rates, and FEMA vaccination locations. Mayor Demings will also reference the valuable work of our strike teams and the reemergence of a very successful effort from last year, 407 Day, and discuss the reopening of Orange County. Orlando Mayor Buddy Dyer could not be here with us. However, Alvina Chu from the Florida Department of Health is here to discuss details on the vaccination process as well as variants surveillance and COVID-19 trending in our area. We'll begin with Mayor Demings. Mayor?
Hey, thank you, Dr. Williamson, and thank you to all of you for being here this afternoon. Hopefully you had a great Easter weekend. We had the opportunity to spend some time with family, and I had the opportunity to attend a church service from my church, first time in many months where we were actually able to see one another in person, but socially distanced in a parking lot for a parking lot service yesterday. So it just reminds me that we are returning to some sense of normalcy. Our emergency management team informed me that yesterday on Easter Sunday, a total of 2,513 people were vaccinated at the Valencia West Campus hub site for the FEMA operation. So that's good news. Thank you to our state workers who have been working with our families to ensure that they had access and that they remain healthy during this Easter weekend. Statewide, the vaccination age has officially been lowered to 16. At this time, the Pfizer vaccine is the only vaccine currently authorized for individuals under the age of 18. As the Orange County Convention Center vaccination site is operational, 16 and 17-year-olds can get a shot there because the Pfizer vaccine is currently in good supply there. In order for a minor to be vaccinated, a parent must be present with the minor. Parents must present an ID, and it is highly recommended that the students bring their student ID card and copy of their birth certificate. Again, the parent or guardian should be present for those who are 16 and 17. There is still a high demand within our community to get vaccinated, and I believe that that's a positive thing for our community. This past Friday, on April the 2nd, over 9,000 appointments for the convention center site were taken in just 43 minutes. To be precise, 9,096 appointments were taken up in 43 minutes. We will make an announcement later this week, probably on Thursday, at our briefing regarding the next opportunity that the portal will open. The convention center site is now vaccinating some 4,000 persons each day. The Florida Department of Health in Orange County site is able to handle up to this 4,000 capacity thanks to the partnership that we have between Orange County government, Orange County Fire Rescue, Orange County Health Services, and the Orange County Convention Center staff working with our State Department of Health at Orange County to make that site a very efficient site. We are excited to get shots in the arms of as many people as we possibly can to help slow the spread of the virus within our community. If you want information, again, about where you can get the vaccine or sign up, you can go to our website at ocfl.net/vaccine. The goals for this week, every week, on Monday we start out and we tell you what it is we hope to accomplish for the week, and I will do that today. First, we will offer the Pfizer vaccine at our convention center site to residents as young as 16 years old. Number two, we will continue to offer free COVID testing to any resident who needs it, and primarily that will be done at our Barnett Park location. We will continue to make sure that county businesses are adhering to CDC standards to keep our patrons and employees safe to any of those businesses located within Orange County. We are doing that so that our businesses can really remain open. You have seen some government-directed shutdowns in other places around the world. We want to certainly avoid that when we get good compliance here. With the expanded eligibility, the Florida Department of Health in Orange County is working with our local college partners to help ensure the 18 to 25-year-old age group is getting vaccinated. As Dr. Pino has pointed out on several occasions, this age group accounts for a high positivity rate, so vaccinating and working within the outreach for this group is essential. Ms. Alvina Shu will likely talk more about the numbers in just a few moments. The local health department has allocated vaccines for the UCF institution as well as Rollins College for their students. The plan is for UCF to administer the vaccine starting on Wednesday to some 2,000 individuals each day. UCF will use their own campus, clinic, and staff to do the vaccines, and Dr. Pino will be monitoring the activities as they move forward. The FEMA-operated vaccination hub at Valencia College West Campus is open 7 days a week between the hours of 7 a.m. and 7 p.m. No appointments are necessary at the Valencia or FEMA site. However, it is best that you try to get there early before noon to ensure that you're able to get through the lines. And now for a news flash, the Valencia site will remain open through May 26, and the federally supported vaccine sites will only offer 1 dose of Johnson & Johnson vaccine. So they will be administering the 2nd dose of Pfizer or Moderna if your 1st dose was at that site. But going forward, they're only going to be offering Johnson & Johnson. We're also told that the FEMA sites will be administering up to 3,000 doses per day. While we're excited about the distribution of vaccine, the coronavirus is still very much alive here within Orange County. Since the start of the pandemic, there have been a reported 125,000+ cases in our county. Nearly 1,200 of our residents have died. To be precise, the numbers that I was given earlier today, 1,198 persons have died of the novel coronavirus within our community. Our 14-day positivity rate is averaging 6.5%. That means it's been increasing since we have been giving you updates within the last couple of weeks. Again, that reminds us that the virus continues to be alive and spreading in our community. COVID-19 testing remains at Barnett Park. Orange County Health Services maintains the site, and we are open there 7 days a week between 9 a.m. and 5 p.m. Both the rapid or antigen testing and PCR testing is offered at Barnett Park through the end of this month. Our business compliance or strike teams have now been operating 191 days. They have now conducted over 10,000 inspections of Orange County businesses with 99% overall compliance. The teams were out this weekend in the Winter Park area inspecting businesses on Park Avenue, Fairbanks Avenue, and the 1792 corridor. I'm happy to report that they found all of the business establishments they visited were complying with COVID-19 safety measures. This is significant in light of the fact that we've accomplished compliance without fines. After more than a year of restrictions due to the pandemic, we reopened some of our county facilities today. The facilities are the county's 2 senior centers, as well as our gyms, fitness centers, and outdoor courts. Capacity at these locations will be limited to 50%. Our summer youth camps will be held at our county parks and the History Center. The lobbies and main buildings have now partially reopened for our public works, building division, zoning, and planning divisions, and utilities. For more updated information on which Orange County sites have reopened, you can go to our website again at ocfl.net. And finally, Dr. Williamson said that we would talk about 407 Day, which is this coming Wednesday. As everyone knows, 407 is our main area code for the Metro Orlando area. So we picked the 7th of April to support our local eateries, hence 407 Days. This partnership with Visit Orlando is an opportunity for residents to help our local restaurants and their employees by ordering takeout or dining in. Local restaurants make up approximately 84% of the hospitality industry in Central Florida. 407 Day is the one day a year that Orange County residents can sit down at a virtual dinner table together or dine at a restaurant and support our community. When you order takeout or delivery on April the 7th, we ask that you please share your experiences on social media with recommendations, selfies, or shots of the food that you are partaking of. If you go on social media, please use the hashtag 407Day. You can also tag Visit Orlando and the Orange County social media channels. We look forward to seeing your photos. You can make a difference by supporting our restaurants on 407 Day. The pandemic certainly has wreaked havoc with our restaurant industry, and 407 Day is an easy way to show our support and appreciation to our restaurant owners. So let's get out on Wednesday and support Central Florida's 6,000 restaurants. And now I'm going to turn it over to the epidemiologist Alvina Chu from the Department of Health here in Orange County.
Thank you, Mayor Demings. Thank you. As the mayor had mentioned previously, as of today, 1 p.m., we've had 125,661 positive cases reported to us in Orange County residents. Our recovery rate remains at 96%, and our 14-day rolling percent positivity rate is up slightly from 6.1% to 6.5%. Unfortunately, since we last spoke, we've had an additional 9 COVID-19 related deaths reported. This is since April 1, which brings our total deaths for COVID-related events to 1,198. The age range of these newest deaths was from 63 to 97 years old, with a median age of 81 years. Our hearts go out to the families and friends during this difficult time. These deaths were in 2 females and 7 males. 2 were Black, 1 was other, 6 were white, 4 were Hispanic, 5 were non-Hispanic. 7 had known underlying health conditions, and 2 had no known underlying health conditions. All the dates of death are from March. 1 of the 9, or 11%, was reported with a long-term care facility residential address. As was previously mentioned about our COVID-19 appointment portal updates, we opened our COVID-19 appointment portal last Friday at 9 a.m. and over 9,000 appointments were booked within 43 minutes. This week, the Orange County Convention Center will have roughly 3,600 appointments each day. We want to thank our staff and partners for doing such a tremendous job, and we'll continue to do so. Based on the numbers, we will surpass the milestone of 200,000 COVID-19 doses administered at the Convention Center. I believe we already have, actually, as of today. And as a reminder, those 16 and 17-year-olds who have an appointment at our convention center vaccination event must be accompanied by an adult who's a parent or legal guardian with the legal capacity to make healthcare decisions for the minor. Emancipated minors must present proof of emancipation. Miles, could you bring up the graph? Wanted to briefly talk about our variant cases. So since the last time we spoke, we've had 37 new variant cases reported to us in Orange County residents for a total of 142. As of today, there were 128 of the B117 variant, first identified in the UK, 5 cases of the B1427, and 5 cases of the B1429, both first identified in California in February 2020, and then also 2 of the B1351 variant, first identified in South Africa, and 2 of the P1 variant, first identified in travelers from Brazil who had traveled to Japan. The event dates for the 2 newly reported B1351 variants is March 21. They lived in the same household and there was no reported travel and no known exposures to other positive cases. The age range for all of the variant cases is from 5 to 84 years with a median age of 39 years. 57 or 40% had no known travel. 2 or 1% had known travel. 1 had known hospitalization, and 56 or 39% had no known hospitalization. While we remain optimistic during this time of our greatly increased provision of the vaccination, we want to remind everyone to continue to practice the pandemic precautions until we can build the community immunity needed to contain the spread of the virus. As far as the vaccine update, there were some unexpected issues downloading this weekend's COVID-19 vaccine data, and because of this, we'll offer an update on the vaccine numbers at the next news conference on Thursday. Finally, we want to remind the community that the Florida Department of Health in Orange County will not hold a back-to-school immunization event this coming school year. I believe Dr. Pino brought this up last Thursday. Healthy Heroes Florida is in conversations with the school board to conduct Tdap vaccinations on 6th graders before they leave school this year. They are also working on a more comprehensive approach for a full vaccination schedule for immunization in the schools this fall. One item for parents: when those permission forms come home with your child, we encourage you to make a point to fill out those forms and send them back with your student. We will keep the community informed as this plan develops. And I'll turn it back over to Mayor Demings, and I'll be happy to answer any questions later.
All right, if there are any questions for our Spanish-speaking media, we have Ms. Ilia Torres and Commissioner Gomez Cordero, who are here that can assist with translation. We also have from the school district, Mr. Scott Howard, who's here should you have any questions, and Mr. Tim Boldick from our compliance team, and other staff members should we need backup to answer any of your questions. So we'll open it up for questions at this time.
Sí. Buenas tardes. Mi pregunta es en español para el alcalde Mayor Demings. ¿Está considerando el condado, está planeando junto a los liceos o las escuelas del condado Orange vacunar a los estudiantes de 16 y 17 años? Y también mencionaba también el alcalde sobre la vacunación a estudiantes en la UCF y Rollin College. ¿Esto va a empezar el día miércoles con citas o sin citas? ¿Cómo es este proceso también?
The question is the county partnering with the school board to provide vaccines to students age 16 or 17 years and older, as well as staff? And there's a second question about the rollout of the vaccination at the colleges at UCF. Will this be with appointments or without appointments? How will that logistic will work out?
Okay, regarding the vaccine availability for students who are 16 and 17, again, we're doing that at the convention center, and I know the school district is working to ensure that the information is shared within the district to parents and students.
Con relación a la disponibilidad de la vacuna para niños de 16 y 17 años, la estamos ofreciendo en el centro de convenciones y estamos trabajando con la ajuste escolar para que le distribuyan la información a los padres de los niños de esas edades.
In terms of the partnership between the Department of Health and UCF with vaccinating students and others there, those are essentially closed pods, and the university is working to make appointments for the students or staff there. The same with Rollins and Ms. Chu. I don't know if there's anything you want to add to that or not. Okay.
Con relación al Departamento de Salud y la Universidad UCF, eso es lo que se considera un punto de distribución cerrado, por lo que el propio personal de la universidad estará administrando el sistema de citas y las vacunas.
Lauren Seabrook, Channel 9. My question's for Alvina. And just one clarification, Alvina, did you say the age range was 5 to 34 on the variants?
If I did, that was mistaken. It's 5 to 84 with a median age of 39 years.
Thank you. I just wanted to know what your thoughts or concerns are on having 2 new cases of the South African variant. I know we've heard, people say that it can be worse than some of the others we've seen. So what are the concerns on that? And is there any increase in, surveillance to find more of this?
So there has been a national push for increased surveillance. You can find those information on the CDC's website. It's called the NS3, which is the National SARS-CoV-2 Strain Surveillance Program. And so we're looking to increase the number of submissions submitted by every state for genomic sequencing and have those sequences publicly published. And they are publicly available from the federal website, the NCBI, and also shared with the WHO and international partners to look for variants. The South African, the B1351 first identified in South Africa, that variant, there have been studies to show that it can be up to 50% more transmissible and also potentially with increased severity of illness. And so with that, you always ask, should we be concerned? So I wouldn't be here if I wasn't concerned, but concern isn't panic. And so as we get the vaccines rolled out to as many people as possible, we hope that people continue to do the pandemic precautions so that we can contain the spread of the outbreak. The event dates, which I didn't have fully up on the chart, range from July 2nd through recently through this end of this month, through the end of March. And so the variants had been present, and we are recently identifying them partly because of this increase of genomic sequencing. And so we would like to continue to press that while we build this immunity and while the vaccines are still very effective against preventing severe illness and death, that we continue these pandemic precautions to get a handle on the spread.
Troy Campbell, News 6. This question is also for you, Alvina. So a couple months ago when we first started talking about the UK variant, you said it was likely we're going to see others as long as this virus can continue to mutate. So now that Easter is over, spring break's over, what are you forecasting now that we have these variants present here, how that affects our outlook of cases?
Right. So we've talked about the variants happen. So we know just in the general course of viral replication, there will be variations every time the virus replicates. So every new infection gives the virus an opportunity to potentially gain some new advantage. Some genetic variations mean nothing, like David Bowie having a blue eye and a brown eye, and some genetic variations mean a lot. I was trying to come up with an analogy, so perhaps the X-Men, we humans we in this room have different genetic variations, but say an X-Man who gains a mutation that increases severe illness or death and destruction, that would be a variant of concern or a variant of high consequence. And so while we know variants occur, we are conducting surveillance and we're trying to gain additional information about what it means for us as far as severity of illness and how effective the vaccines remain and how effective we can be at identifying these cases. Because eventually, Eventually, there may be some mutations that are able to evade our control measures. And so this is why it's so crucially important right now, while we have really good and effective vaccines, that we continue the pandemic precautions to contain the spread and to reduce the number of new infections. Thanks.
Hadass with WESH 2. Mayor, our desk has been getting a lot of questions from people who want to know if there's any kind of a timeline at this point for the mask mandate to end. Obviously, you guys are seeing data to indicate that the virus is still very present in our community. What would you want the message to be on that front?
Hadass, when do you want it to end? Caught her by surprise. Huh? Well, yeah, the mask mandate will end, I think, as we get closer to maybe 50% or better of our total population having been vaccinated. And depending upon how soon we get the shots in the arms of people, will make that determination. Suffice it to say, I believe that by the time we get to June, perhaps we should be there at that point. We'll see. And it's contingent upon the spread of the virus within our community. You heard Ms. Chu talk about the variants, and she talked about one particular strain, the African variant, and how it is able to spread rapidly, and it appears to be fairly contagious and infectious. So given all of that, as our epidemiologists monitor the spread of the virus in our community and the various strains of the virus, we'll have to make some decisions, but I remain optimistic that we may be able to do that within the next month or two.
This is
So
Emily.
was that good enough answer for you? Okay,
So sorry, Mary, I didn't mean to cut you off.
no problem.
This is for Alvina. This is Emily Braun with News 13. So given that there are, more and more variant cases being reported, do you foresee an increase in testing for these variants or more frequent testing being done in the near future?
We do. There has been a push from the federal level to increase the surveillance for these variants, genomic surveillance in general, to track what kind of changes are happening. There is also, the CDC has publicly published its data about how many sequences are received from all of the states and what percentage of those sequences have been completed from each state. So that's available on the CDC's website.
All right, this is Melissa Thomas of Florida National News. This question is for Mayor Demings or Mr. Boldy, either one. I just wanted to get your personal take, Mr. Mayor. Obviously, there was the story of the gentleman who had to be removed from Disney Springs. I think he was fined because he refused to do a temperature check. Now that we are through spring break and through the Easter holiday, are you guys still seeing cases like this where people are not as compliant?
No, it's a rarity that our residents are not compliant, or the visitors who are here. Generally speaking, when they come through the airport officials are telling me that they're very compliant. When they enter the various businesses, our theme parks, our other tourist attractions, our hotels, they're generally compliant. When our compliance teams go out and inspect the businesses, they find 99% compliance. So it's a rarity indeed that someone doesn't want to follow the mandates that are in place.
Hi, this is Sam Soso, Fox 35. Either of you guys can answer this question. Feel free to jump in if you have thoughts. But since the age range opened up today, are you guys finding that 18 to 25 group are the ones getting the vaccine, or is it still an older population who's going out to get it? What did you guys see today in terms of that?
So I mentioned we had a little technical difficulty with the immunization database, so we'll have some more information about that on Thursday.
Well, and on Thursday,
Mayor Demings
we're
might.
going to bring some youth in, college students and others who will get vaccinated. And we hope that that serves as a symbol to other young people that they too should not be afraid of getting vaccinated. We need them to get vaccinated within our community as well.
This is Steve Hudak from the Sentinel. This is for Mayor Demings. Has any thought been given to setting up pods outside of, well, clearly we're doing some pods at UCF, at Rollins, but some other pods, some places like downtown around the bars or to try to reach younger people?
Yeah, you know, there have been locations in at and around our downtown area where we've done some pods, but this week it appears that the available inventory is going to increase significantly. Once we really receive the doses, we have a plan of action here in Orange County where we will do mobile pods. We're going to strategically go into communities where perhaps there's an underserved population or where we are seeing geographically where there's a lag in people getting vaccinated. But we'll roll that out. We'll make the announcement perhaps by the end of this week about the strategy that will soon begin in that regard.
This question was texted from Ryan Lynch in the Orlando Business Journal for Mayor Demings. The question reads, has the county had any recent conversations with private employers about setting up vaccination pods? If so, who and what might that look like?
We have had conversations with different community partners or stakeholders about bringing a potential vaccination site to their area or to their location. And those are ongoing conversations that we have. It becomes fairly difficult if we single out a particular business. We value the partnerships that we have with all of our businesses, and we don't want to appear that we're showing preference to any one of them because of, you know, the fallout from that. There's been some criticism, obviously, in the state of Florida about the rollout of the vaccine, where some people feel that they did not have equal access, and we don't want to find ourselves in the same position as a county, but we will strategically look to move geographically around the county to ensure that all segments are getting access to the vaccine.
Thank you. That's all I have.
All right. Well, if that is the final question for today, the next press briefing will be on this coming Thursday at 4:30 p.m. Thank you all for joining us, and Ms. Chu is available for any one-on-ones afterwards. And Commissioner Gomez-Cordero is available for one-on-ones.